What laws or policies would be helpful for people living with pain? Hello, this is Dr. Siddharth Dambar, expert in rheumatology and regenerative medicine, physician here at Chicago Arthritis and Regenerative Medicine. Question asked of me recently was, what laws or policies do I think would be helpful for people living with pain? There's two main things that I can think of that are pertinent to me. The first is that people need to be able to have access to the available approved treatments. This sounds really obvious, doesn't it? Because if a treatment has been tested, is accepted by physicians, has gone through a formal regulatory pathway with the FDA, shouldn't those be available to all patients who are appropriate for that treatment? The reality is that is not the case these days. In the past, the person who used to help you to decide what treatment was appropriate for your condition was really just your physician and you. And that's how it should be. Your physician understands your medical condition, understands what you've been on in the past, and in conversation with you, likely understands what treatments you're open to doing and what kind of results you're looking for. And based on that, your physician could then help guide you as to what is your next best treatment choice. Now, we have another player that's involved in these decisions, and that includes your health insurance. So as treatments have gotten progressively more and more expensive, health insurance has progressively put in various hurdles and gatekeeping steps, including prior authorizations. There is a legitimate purpose for prior authorizations in that there's not an infinite amount of money, and cost of care can be very expensive, and they want to make sure that a recommended treatment is appropriate for that individual. As much as physicians may not be thrilled with that, the reality is that health insurance's purpose is to make sure that the money that is being spent is appropriate for that individual and patient. That makes sense. The thing is that over time, it's become clear that health insurance is going from being a reasonable partner in this process, meant to help patients get the care that they need and deserve, to being one that is more preventing, gatekeeping, and even redirecting treatment, to the point where you start to wonder who's really directing medical care. Is it the physician who knows the patient and is treating the patient, or is it the health insurance, which is looking at data and numbers and actuarial numbers and making financial decisions? That's a dangerous place for health insurance to be stepping into. And you see it in a few different ways. Number one, you'll see it with protracted prior authorization times, where it's not enough for the physician to submit their records, fill out paperwork, and jump over the hurdles, but there's an auto denial process where now, in order to appeal that denial, there's more paperwork and documentation required, more phone calls that are required, and in the end, whether that is done purposely to delay treatment to save costs, or whether that goes through a process where eventually the deciding party is not even a physician, an expert in that field who's making that decision, or whether it's just an AI or someone who does not have any medical training that's making that decision based on whatever black box criteria the insurance company has. In the end, it leads to reduced access to care for patients, and it leads to denial of care for patients. And it leads to patients who are living with pain. It leads to them having more suffering, pain, disability, lack of quality of life, lack of work, lack of activities. And before people think, hey, we're just talking about treating pain, this is more than just treating pain. This applies to everything. So this applies to, in the world of musculoskeletal medicine, this applies to people who could have injuries that require surgery. This could apply to people that have chronic autoimmune issues, who are severely damaged and declining if they don't get treatment, who can have not only pain and functional limitations and disability, but if their condition's not treated, they then have higher rates of cardiovascular disease, cancer, and even death. So these are things that can start in one small scope and then mushroom to a much bigger thing. And of course, these kind of health insurance problems not only apply to just people living with pain, but apply to every aspect of medicine, including things like heart disease, cancer, and every other type of medical issue that people have. So I think restricting the tyranny of health insurance in terms of how they make their decisions so that they are accountable to not just their shareholders, but also to their clients, which is all of us as patients, that they have actual accountability there as well. I think laws and policies that put them in check and make them accountable is absolutely needed and essential. Now, the next one is I think we need better policies and consistency when it comes to experimental treatments. So in the world of musculoskeletal medicine and dealing with people with orthopedic-related pain, there are a ton of new treatments that are coming on board. The ones that I'm most involved in are regenerative medicine or orthobiologic treatments. It's like platelet-rich plasma, bone marrow stem cells. So there's a lot of data now, over 20 years, that shows validity and indications for when these treatments are acceptable and when they can be helpful and when they should be used. You know, the nature of certain types of treatments, especially procedural related treatments, rather than medication treatments, is that there's not necessarily a formal FDA process to say these procedures are acceptable. So using your own blood, using your own bone marrow, the FDA is not going to say that they approve the use of your blood or your bone marrow because that is your own blood and bone marrow and it's already utilized for various other surgeries and reasons, but they will give guidance and structure for when it is appropriate to be utilized. That's appropriate. And that combined with physician organizations defining when these treatments are appropriate, combined with the medical literature, is how these treatments should be utilized for people and patients. So that makes sense. So when it comes to orthobiologic treatments, the general rules are that, number one, if you're using living cells, your blood or your bone marrow, it should be cells that are coming from yourself, not from somebody else. This is in the United States. So that's number one. Number two, it should be that when you take those cells, they should be cells that are naturally involved in that same tissue. So we know that after an injury, you have blood platelets that are involved in trying to recover from an injury. We know that your own bones have mesenchymal stem cells. So utilizing some of these tissues makes sense for orthopedic use, right? The next is that when you harvest those cells, they need to be processed in as minimal a way as possible, and they need to be reused the same day. You do that because you are minimizing the risk of infection and other types of problems. Very fair. And then lastly, the current rule is that those treatments need to be utilized for musculoskeletal or orthopedic tissue, not for other conditions. And the reason for that is because that's where the overwhelming amount of data is over the last 20 plus years, as opposed to someone who may be trying to utilize this for treating things where it's not as well tested. Let's say things like heart, lung, kidney issues. Until there's more data, right? The regulatory bodies say it needs to be a little bit more restricted to this. So that's the current regulatory framework. And that's pretty clear. And if functioning in that, then you should be okay from a regulatory framework to utilize this. If you have the right training, and you're doing this in appropriate patients, picking the right patients based on what the data shows is appropriate, you should be low risk to proceed. That makes sense. What happens in reality is that either because of lack of resources or lack of oversight or lack of interest, you end up seeing that there are people who are working drastically outside of that framework, either utilizing products that don't fit into that framework or companies that are advertising products to physicians that don't fit into that framework. And you find that there is occasional regulatory action against those folks, but it's not consistent, it's not regular. And what happens is that it becomes confusing for treating physicians and vendors and companies that are involved in this space, and it certainly becomes very confusing to patients, thus muddying the whole field about what is legitimate and not legitimate. And so I think from a law and policy standpoint, it should be that regulatory bodies are clear about what they deem to be appropriate. Here are the rules, and then actually stick to that and actually enforce that appropriately. If they do that, it becomes much clearer to patients about what is legitimate and what is not. It becomes very clear to companies in this space, physicians in this space, about what is appropriate to utilize in patients as well. To me, it seems pretty clear, but I see colleagues and I see companies who don't seem to be fitting into that framework, which to me indicates that maybe the regulators could be a little bit better at that. So to me, the two big things that I think would be helpful from a law and policy end for people living with pain is, number one, reducing the amount of overreach that insurance companies have that are restricting care for people who are living with pain and have real medical issues. And number two, regulators being very crystal clear about what is appropriate for experimental treatments, and then making sure everyone stays within that regulatory framework. Thanks for your time. Any questions, please let me know. Until we connect again, have a good day and live well. Bye-bye.